The honourable member for Niagara West, Glanbrook.
Thank you very much, Mr. Speaker. And I want to thank you for the opportunity to speak in the House about Ebola and the tragedy unfolding in West Africa. I will be splitting my time with the member from Kootenay, Colombia. Colleagues, West Africa is currently experiencing a devastating Ebola outbreak. This outbreak of Ebola has been ongoing in West Africa since December of 2013 and was officially declared an outbreak in March 2014 by the World Health Organization. On August 8, 2014, the World Health Organization declared Ebola a public health emergency of international concern. The Government of Canada is closely monitoring the Ebola outbreak in West Africa, and we are also working closely with our international partners to support a coordinated response. Our thoughts are with the citizens of the countries affected by Ebola, as well as with Canadians who have loved ones in those countries or who are working there as part of the international Ebola response effort. I would like the members of Parliament and all Canadians to understand that the risk of Ebola in Canada remains very low. There has never been a case of Ebola in this country. However, rest assured that we are well prepared should this occur. The Public Health Agency of Canada continues to work with the provinces and territories to plan and prepare for the rare chance that Ebola is ever imported into Canada by a traveller from an affected area. The Government of Canada has a number of systems in place to identify and prevent the importation of the Ebola virus into Canada. The Canada Border Service Agency and the Public Health Agency work together to ensure that travellers from affected countries are healthy when they arrive in Canada and are aware of actions they should take if they begin to experience symptoms of illness. Mr. Speaker, I would like to take a few moments to provide more background information on what exactly Ebola is and how it is transmitted to humans. Ebola is a severe viral disease that causes hemorrhagic fever in humans and animals. Hemorrhagic fever are infectious diseases that can be associated with severe and life-threatening bleeding, as well as severe dehydration and organ failure. It is important to note that Ebola virus does not spread easily from person to person. Ebola is introduced into the human population through close contact with the body fluids of infected animals. In Africa, fruit bats are considered possible natural hosts for the Ebola virus. Although contact with infected animals results in the introduction of the infection to humans, once contracted by humans, Ebola spreads in the community through human-to-human transmission. Unlike the flu or other respiratory infectious diseases, it is not airborne and cannot be transmitted through casual contact. In the current outbreak in West Africa, spread occurs primarily amongst close contacts, family caregivers, and as a result of local customs such as burial rituals. The incubation period for Ebola, meaning the time between exposure and the onset of symptoms, varies between 2 and 21 days. Infected persons become contagious only when they have symptoms. Although infected, they are not contagious during the incubation period. Ebola is a challenging disease to diagnose, as it has a wide range of common symptoms associated with a number of illnesses in Africa, such as malaria. It can only be medically confirmed through specialized laboratory testing. As I mentioned earlier, Ebola does not spread easily from person to person. It is spread through direct contact with infected blood and bodily fluids. In Canada, there has never been a confirmed case of Ebola. In the unlikely event that Ebola is ever imported into the country, our hospitals have sophisticated infection control systems and procedures in place that are designed to limit the spread of the infection, protect healthcare workers, and provide the best care possible for the patient. At this point, I would like to give you an overview of the current situation in Africa. The current outbreak began in Guinea in December of 2013 and spread to Sierra Leone and Liberia, prompting the WHO to announce the outbreak in March 2014. The virus continues to be actively transmitted in these three countries. There has been a very limited spread of Ebola into Nigeria and Senegal, associated with single travelers from Liberia and Guinea, respectively, We are optimistic for the containment of spread within these two countries due to the infection prevention and control measures that have been put into place. In Nigeria, there have been 21 cases associated with the initial traveller from Liberia and 8 deaths. In Senegal, there has been only one travel-related case reported, and that individual has since recovered. No further cases have thus far been reported. The good news is that countries around the world are rallying together to respond to the outbreak. The international response to Ebola is gaining momentum, and Canada has been an important part of this response since the beginning. Canada has contributed over $5 million in support of humanitarian, security, and public health interventions to address the spread of Ebola. To prevent the spread of the disease to other countries, affected countries have implemented measures, such as questionnaires and temperature monitoring, to ensure that individuals who have been exposed to or infected by Ebola are not able to board flights. To date, there has been no spread of Ebola by travelers outside of Africa, and there has not been a single case of Ebola contracted on a plane. Ebola first appeared in 1976, and outbreaks have since been primarily occurring in remote villages in Central and West Africa, near tropical rainforest. This current outbreak is the largest one on record. There were a number of complex factors and significant challenges related to the management of this current outbreak, and I would like to share with you. First, Sierra Leone, Guinea, and Liberia, the most affected countries in the current outbreak, are small countries and have limited resources to respond to prolonged outbreaks, especially in rural areas. The fact that Sierra Leone, Guinea, and Liberia have multiple areas within their borders where infection is spreading adds another layer of difficulty to contain the infection. When the outbreak takes place in remote and forested areas, it is easier to maintain a certain natural containment of the disease. However, in this current outbreak, in addition to remote regions, infections are also happening in large cities, where transmission of disease can affect many people in a short time frame. Among other things, miscommunication has also contributed to the negative perception by some communities of the success of outbreak control strategies, thus slowing down response efforts. The varying healthcare infrastructure from one country to another, plus certain cultural practices, such as burial rituals, also add to the complexity of the outbreak and its containment. As the outbreak has expanded and gained momentum, measures have been put into place to contain its spread, which have also impacted relief efforts. Movement of people in and out of affected countries has been impacted by travel restrictions implemented by affected countries, as well as suspension of flights by regional and international airlines. These measures have created challenges in transporting scientists, laboratory specimens, and the replenishment of equipment and supplies necessary for the response. Despite these challenges, international efforts continue, and many countries, including Canada, are exploring alternative ways to contribute to the outbreak response. I would like to take a moment to especially recognize the tremendous contributions non-governmental organizations have made in the response to the outbreak in West Africa, including Doctors Without Borders, the Red Cross, and Samaritan's Purse, among others. It is important for Canadians to know that the risk posed by Ebola to Canadians remains very low, as the virus is not transmissible through casual contact, and there exist robust systems in place to prevent importation. Canadians should also know that the Government of Canada is supporting the international response in West Africa to reduce the risk of international spread of this serious disease. Let me finish by reassuring you that the Government of Canada is committed to the health and safety of Canadians and will continue to work closely with our international partners to support the response. The Public Health Agency of Canada remains committed to review and update in collaboration with its provincial, territorial, and health system partners, the domestic health emergency management and response system to ensure the highest degree of public health possible for Canadians. Thank you very much, Mr. Speaker.
Question et commentaire, l'honorable député de Laurier-Saint-Laurent.
Merci beaucoup, Monsieur le Président. Et j'aimerais remercier mon collègue pour son discours, sa présentation. J'aurais deux questions essentiellement pour lui. Est-ce qu'il est d'accord avec la plupart des experts qui nous disent que nous sommes en train de perdre cette bataille-là et qu'il faut vraiment mettre dès maintenant beaucoup de ressources si on veut éviter de faire face à un problème beaucoup plus important dans le futur? Ça, c'est ma première question. My colleague also said that countries are providing a response to the crisis. But if I take just one example, the UN and WHO have asked for $600 million on an urgent basis to face the crisis, but they've received less than 1/3 of what is needed. So does he think it's the right level of response from the international community? Thank you.
The honourable member for Niagara West, Glanbrook.
I want to thank my honourable colleague for the questions, the two questions. I know that we work well together in the Foreign Affairs Committee, so it's great to see her in the House tonight on this debate. I just want to address the first question in terms of losing the battle, in terms of more resources. Not being an expert, I don't know how much money we would need. You did mention in your second question about the $600 million. I know that you're aware of the money that Canada's committed, the $5 million, and then just tonight, about an hour or so ago, the Minister of Health promised or made an announcement for an additional $2 million for personal protective equipment. So I think that's a good start. I know that one of the things that we need to continue to do is work with the international community, because it's got to be a collaborative effort. And I think that if we look at a number, if it was to be $600 million, that seems like a huge number. But I think that as we can continue to work with our partners on the ground, as we could continue to work with the WHO, we can work to figure out what the needs will continue to be in the coming days.
Before I go to questions, just remind all honourable members if they could direct their comments, references to the chair rather than directly to their colleague. The honourable member for Kootenay, Columbia.
Thank you very much, Mr. Chair, and thank my colleague for his speech tonight. Going along the part of the question that or the answer that he just provided with regards to the additional $2 million that the minister spoke of tonight, could that member please expound upon what that protective gear would do to help those people that are trying to assist people with the disease in Western Africa?
Honourable member for Niagara West, Glanbrook.
And I also like to thank my colleague for the question, who will be up speaking next. You know, in terms of the $2 million, and if I could just respond a little bit to what's been committed so far, just to remind our friends at home that are watching, there's, as I mentioned, over $5 million to stop the outbreak, which includes $2.95 million to the WHO to strengthen field response to the outbreak and mitigate associated threats to health and safety, $1.7 million to support humanitarian interventions led by Doctors Without Borders to reduce and control the spread of the virus in Guinea, Liberia, Sierra Leone to provide care for those affected, $160,000 to the International Federation of Red Cross to support the response of outbreak in Guinea, Liberia, Sierra Leone through its Emergency Disaster Assistance Fund, and $200,000 to the WHO through the International Health Grants Program to support a request for assistance towards operational costs in West Africa and the coordination and deployment of international technical expertise. The question that the member just asked me was in addition to the amount that was announced tonight, $2 million by the Minister for personal protective equipment. I think, once again, that was a request made by the international community just last week, and here we are responding within the week, and that would to provide gowns and gloves and a number of things that would keep the workers keep them safe as they essentially put their lives on the line as they go into to deal with these cases and work with people that are affected. So that $2 million, I believe, will be very helpful in terms of personal protective equipment to help the workers, the people that are on the ground, to get in and to deal with the affected people.